According to Transatlantic Society of Consensus Guideline on Vascular Disease, peripheral vascular disease are divided into 4 types. Type A, Type B, Type C and Type D. Coming to Type A, here it can be a single stenosis which is less than or equal to 10 centimeter in length, or it can be a single full occlusion which is less than 5 centimeter in length. This is Type A lesion. Coming to Type B, here you have 5 different type of lesion. They can be multiple lesion which can be stenosis or occlusion, each less than 5 centimeter. That is one type. Or it can be a single stenosis or occlusion which is less than equal to 15 centimeter, but it does not involve the infrageniculate popliteal artery. It can be a single or multiple lesion in the absence of continuous tibial vessels to improve the inflow for a distal bypass. That is third type. And coming to the fourth type, it can be an heavily calcified occlusion which is less than equal to 5 centimeter in length, or it can be a single popliteal stenosis. These are all the various Type B lesion. Now coming to Type C lesion, it can be multiple stenosis or occlusion. In total, it is greater than 15 centimeter with or without heavy calcification, or it can be a recurrent stenosis or occlusion that needed treatment even after 2 endovascular intervention. This is Type C. Coming to Type D, here there is chronic total occlusion of common femoral or superficial femoral artery which is greater than 20 centimeter, and it can involve the popliteal artery, or it is a total occlusion of the popliteal artery and the proximal trifurcation vessels. This is Type D. Why you have to know about this various types of peripheral vascular disease? Because an intervention might change with each type of lesion. In Type A, endovascular treatment is the treatment of choice. In Type B, endovascular treatment is more often used, but there is insufficient evidence for recommendation. In Type C, more commonly surgical treatment is used. Again, there is insufficient evidence for recommendation. And Type D, you don't have any other choice, you go for surgical treatment. So, A is endovascular and D is surgery. But in Type B and C, your experience and guidelines may vary whether you are going with an endovascular or a surgical repair.